My name's Sharon Black. I'm with the People's Power Assembly. I am a retired registered nurse. That's some of my background, and also a home care worker in that capacity as an RN when I was employed. That's a little bit about me. I also have lived in Baltimore City for approximately 40 years. So I think in opening up, we clearly wanted to send our love and solidarity from the bottom of our hearts to the people of China, to Iran, to Italy, to actually the entire world at this point, Korea, Japan, and everywhere where people are suffering from this disease. It is an illness, it is a virus, it is not connected to any nationality. So I wanted to open up with that solidarity and love that we feel for everyone who's been impacted by this pandemic. So I'm actually going to read this so that we won't take too long before we open up the mic to some of the other people who've come out in the community. But I wanted to start with this. This is a work in progress. We are continuing to reach out to other unions, to other community groups, to people in the housing projects, to people representing the homeless, and so many other groups, and a lot are expressing interest. So these are just beginning proposals. We are hoping and seeking to work with the Baltimore Health Department, with the city, in a cooperative and proactive way. So I just wanted to start with that before I read some of the proposals that we have. As healthcare workers and advocates, and as community civil rights and union organizers, we call on city and state officials to begin preparations to protect the people of Baltimore, especially those most vulnerable for a COVID-19 outbreak in our community. We believe there are special considerations to be addressed in Baltimore City. For instance, most of our population are low-wage workers living paycheck to paycheck. Close to 25% live below the poverty line, and a large number of people, regardless of age, have chronic illnesses such as diabetes, hypertension, heart disease, that put them at a greater risk for death. Concerns for the elderly and the poor, the homeless, prisoners, and our immigrant population need to be addressed sooner rather than later. These considerations are not only critical for Baltimore, but for workers and the poor across the state of Maryland. As such, we are disseminating this to the governor, state, and the Senate delegates also. We therefore request a meeting with the Baltimore City Health Department and other political officials and leaders so that we can jointly address our specific concerns and our proposals. I want to review some of these proposals and concerns. As I said, this is a growing list. It's just a beginning list. But we believe full paid leave, sick and child care leave to all impacted workers for the duration of the time that workers are forced to be off their jobs. This includes workers who are sick or quarantined, and also school workers. And I apologize. Teachers, support staff, custodial workers, etc. It includes parents who are forced to stay home with children. Number 2, no reprisals or job losses for workers who are sick, quarantined, or taking care of school children or family members. Halt evictions and foreclosures for those who are sick, quarantined, or cannot work due to the crisis. Develop a plan on how food can be distributed and delivered to vulnerable families and individuals who cannot stockpile supplies. 5, a large number of school children in Baltimore City depend on school-provided lunches. Implement a plan in each school to deliver lunches to children in the advent of school closings. Include teachers, their union, and parents in this plan. Provide a phone hotline staffed by medical professionals so that those who do not have primary doctors or nurses can get clear health instructions so that testing and other home health services can be coordinated. Provide free broadband internet service through Comcast so that all city residents, including students without service, can be connected for emergency communication and schoolwork. 8. Develop a free app that can be downloaded to phones and computers so that alerts can be sent out to dispel rumors and deliver people-oriented preventative health education. Make sure 9 rather, make sure everyone is fully covered for all medical treatment, including testing, and suspend debt in the advent of a major crisis. This is very important. 10, and it's dear to my heart, of course, and some of the people here. Protect all healthcare and frontline workers, nurses from the national. Okay. Protect all healthcare and frontline workers. Consult with union representatives from the National Nurses United, 1199E Healthcare Workers Union, United Food and Commercial Workers, and with workers directly. Make sure that there is adequate personal protective equipment for all frontline workers. This includes also EMS workers and a whole host of others. Fire workers included too. I apologize because the wind is just blowing us to pieces. Develop and distribute an app for all willing and able healthcare providers, nurses, doctors, EMS from the broader community so that they may be called up to act as frontline teams if needed. Make special provisions now for undocumented and immigrant families who may be fearful in reporting illnesses due to fear of deportation. This includes suspending all deportations and consulting with the immigrant community. Make sure that plans, number 13, make sure that plans are being made to specifically service the homeless, both in shelters and in the street. 14, address the rights of those who are incarcerated, especially those in city jail, to make sure that loved ones who are locked up are not forgotten and at risk. 15, we have some questions. What is being done by the Mass Transit Administration to ensure that commuters and bus riders are as safe as possible? For instance, frequent cleaning. 16, we asked that the city and the state government dispel racism and racist stereotypes that have been promulgated during this pandemic, and that accurate medical information be made widespread to the public now rather than later through TV and radio ads. It is critical that no community is targeted or blamed. The people of Baltimore and the many organizations that belong to are a tremendous resource that can be drawn on a time of struggle. The city and state government has the power to declare a state of emergency to provide for the people and take action to promote not only people's health and safety, but to protect people from evictions, job and wage losses, and much more. Addressing these proposals protects the health of the entire population. Unless low-wage workers, the poor, and those most vulnerable are assured that they will not be stigmatized or suffer great losses, they will be less able and willing to be quarantined. Unless we involve frontline healthcare workers and the community organizers in being part of the solution, we will be hampered in the fight against this pandemic. I apologize for the wind and not being able to deliver this in the way that it deserved, but but I'd like to ask a few people, to actually state some of their things. I just want to let the press know that this is our first press conference. We will be inviting you to community meetings, and hopefully along with the Baltimore Health Department and with city officials. So I'd like to call up the representative from the National Nurses Union. She is one of the frontline workers that we refer to. Jenny.
Hi, thank you, Sharon, and thank you, People's Power Assembly, for this important conversation. As we know, epidemics affect the most vulnerable in our society the most. So your list of comprehensive demand is very important. And it's also very important that we address the needs of frontline workers. Because if nurses are not protected, then nobody is protected. So National Nurses United is the nation's largest RN union. And when coronavirus, so at the beginning of the coronavirus outbreak, we issued a national survey to all nurses to see how prepared they are within their facilities. And our results were shocking. So 44% of nurses said that their employers provided them information on COVID-19. 29% said that there was a plan in place to deal with COVID-19. 23% do not know if there is a plan, and 30% have reported that they have sufficient personal protective equipment at their hospitals. These numbers are abysmal, and they put our frontline caregivers at great risk, not to mention the patients that they need to take care of. This is why it's so important that nurses have a seat at the table, not just when epidemics occur, but even before that, to make sure that we're never in a position where we have to catch up, where we have to run against the clock to make sure that everybody is protected. So in addition to hospital preparedness, we're also calling for vaccines to be free when they are produced. So Trump and Mike Pence just budgeted $8.3 billion to address this epidemic. Much of this is going to private research labs, and the public is already paying for this drug. So patients should not have to be worried about how they are going to pay for the vaccine, how are they going to get care. They should not feel deterred from getting care because of high medical costs. And they should definitely not feel deterred from getting care because their hospital is suing them for medical debt, which is something that has been well reported that Hopkins is doing. So, NNU is also calling on Hopkins to stop suing their patients. Now more than ever, especially with the fear of this epidemic, this should not be part of the conversation, and patients should not be afraid to seek care. So thank you so much again for being here. Thank you for bringing light to this important issue for nurses and patients.
Thank you so much. Dr. Marvin Cheatham, who is a civil rights leader in Baltimore City.
Good afternoon. Thank you so much for being here, media. There are some major concerns that have been printed out and I think really captured extremely well as to what the plight of our citizens are. This is a holiday season to some extent, and there's always talk about what we do for the least of those. Well, we have to understand that what we are encountering, we have not come together as a community. Our elected officials have not brought us together. And I can't thank the group well enough, the People's Assembly, for not only coming and having this event, but documenting the concerns that many of us are having. I received an email just yesterday from Tony White, representing the mayor's office, and they gave us a really good list of things that we need to do as citizens to protect ourselves and protect our loved ones. And I emailed back and thanked and congratulated him and the mayor, but I encouraged them to take that listing and post it in many buildings that we can. What we need to do now is to come together as people to understand that the least of these are going to be the ones that are going to be neglected, the ones that are not going to get the proper attention, the ones that may lose their jobs, the ones that are going to be asked, do you have money to pay for this? We need to come together immediately. I am a neighborhood president. I am president of Matthew Henson Neighborhood Association, and I've headed up 3 civil rights groups here. I wish that they were here. I'm calling out the NAACP, of which I was president. I'm calling up the National Action Network, of which I was president. I'm calling out the Southern Christian Leadership Conference, of which I was president. These are the civil rights groups, and they need to come here and stand with us and fight with us and let the city know that we don't need you telling us what needs to be done. We need you to come work with us because we all need to address it. This is a worldwide problem, and we are saying Baltimore cannot be eliminated. I am fearful. I am very fearful. I live in a community that basically is the Freddie Gray community. But because of the poor leadership of this city, we are not in the opportunity zone. I live in a neighborhood where 25% of the neighbors in other communities do not have a food market. There are so many inequities that are taking place in this city that we must come together. Those of us that are seeing this and hearing this, we must demand our elected officials in City Hall in Annapolis look out for us at this point. But neighbors, I'm saying to you, you need to rise up at this point. Don't wait till you find out that your child is sick, your loved one is sick, and you're wondering then who is going to look out for you. Baltimore, we need to rise up. And I thank the People's Assembly for bringing this together. I'm willing to do any and everything I can as a neighborhood president to bring us together. Let's put aside our differences. This isn't a Democratic issue, a Republican issue, a Green issue. This is a people's issue. We must come together and save our lives. I just can't thank everyone, especially the media, for being here. We need to let folks know, Baltimore, we know we will become victims if we don't stand up. God bless you, and thank you for having me here.
Thank you, Dr. Cheatham. I'd like to call up Reverend Annie Chambers. She is a housing advocate at Douglas Homes, and Reverend Chambers has also represented the poor.
Thank you very much, People's Assembly. Thank you, Sharon. Thank the media and everybody that's here. We want it to be known loud and clear that if this is a serious matter, if this state, this country, does not take hold and help the poor, not thousands but millions of people will die in the street. We are at a critical time for homelessness in America, in Baltimore City, in the state of Maryland. In this state, we got more homeless people than we have ever had. Ever had. And where do they go? Who helps them if they get the virus? Where do they go? There's no homes. You have children, mothers, fathers, walking the street all night long, sleeping on park benches. And children going to school in the schools. You know, you're putting everybody at danger. You're playing with lives because we can't turn those people out. We can't turn us out because I consider myself one of them. I live in public housing. What happens when we go to the hospitals and ask for care? We're already stuffed in the waiting rooms waiting for 10 hours to get any kind of treatment. So we will never even know. Some of us will die with the virus and never even know we had it because the treatment is so poorly already in health care for poor, working class and homeless people in this country. So we have to stand up, come together. I am glad Doc called out some organizations, but I want to say to all of the churches, this ain't about Sunday morning disco. This is about people. Every church in this city, in this state, should be standing here with us because it's going to affect all of us. It's going to affect all of us. Even if you just, somebody told me I'm just going to stay in my house, and I fell out laughing because that's not going to help me either. Even though they have not put any protection in the poor and working class neighborhoods against corona right now, we have to stand up and demand. And since the president doesn't feel like it's serious, but Pharaoh didn't think it was serious either. But his child died. And I want him to know, none of us, all of us are vulnerable to this. So we want to stand up and fight. Thank you.
Thank you, Reverend Chambers. Just so that the press knows, we have two more people we're going to present. There were a couple other people that represent different committees that were going to speak, but I think that they have declined right now, just so that we'll have a short press conference, and then the press wants to interview people. There's also a number of people that have come out. I call them fellow colleagues because I'm a retired nurse, but they've come out in larger numbers. So I'd like to call on Andy and then Bonnie. And Andy represents the Green Party, and Bonnie is a longtime home advocate for the homeless.
Thank you very much. I'm excited to be out here today to stand in solidarity with the people and organizations that are pushing forward this agenda. The Maryland Green Party is calling on all people who are seeking office right now or are in elected office right now to join us in pushing for these proposals that are important for this city. They speak to the heart of the crises that most of your platforms are about, and we ask you to join us in helping to make sure that this city is ready in order to fight for the most vulnerable people when the virus hits here. So we thank you very much. We're excited to be here, and as the Green Party, we again ask each person seeking office in this city right now to take some time, consider these proposals, and make sure that they're joining their forces together for what is good for the heart of the city. As Dr. Cheatham said, it's not a partisan issue. We welcome everybody to this fight because we are going to need everybody in order to make sure that we are prepared for this when it comes. Thank you.
Absolutely.
Hi, I'm Bonnie Raven Lane, advocate for the homeless, formerly homeless. I'm first going to call out the Weinberg Housing Resource Center, the largest homeless shelter in Baltimore City. You need to open the day rooms, not just when it's code blue, but anytime there's bad weather. The homeless people are outside waiting in line 2 to 3 or more hours to get inside a building while they're already sick, which is not helping anybody. If not, they'll catch things and be sick from waiting in these lines. You need to make sure you have adequate supplies of soap, hand sanitizer, towels, etc. I know when I stayed at the old shelter, when it was back in the parking garage on Guilford Avenue, frequently you'd go up to take a shower and you wouldn't find any of these things available. I'm calling on all providers to make sure that you have adequate supplies. I'm calling on the city of Baltimore to have some kind of portable hand washing or sanitizing stations set up where they know homeless people are allowed to crowds of people gather. Like right around here, there's homeless people that sleep here any night, and I don't see any way they can do anything about anything. Also, homeless people don't have access to bathrooms like porta potties or anywhere that they can sanitize anything if you're out in the street. So I'd really like to see a change in that. I also like what they're saying about the mass transit cleaning and stuff, because I take the Maryland Torture Authority almost daily, and I'd like to see something done with that. Thank you.
Thank you, Bonnie. And this is a great example of what we need to do is for the government officials and for the Baltimore Health Department to sit down with us and to talk, because we have a lot of the solutions, because these are the people that are impacted.